Hello, I'm Dr. Hancock. I'm an endocrinologist, and I've been an endocrinologist for approximately 17 years. What I'd like to talk to you today would be diabetes. Diabetes is an epidemic in this country as well as in the world. The most common type of diabetes that we see here in our practice, as well as worldwide, is going to be type 2 diabetes. Type 2 diabetes is the form of diabetes that typically occurs when someone is older. It's usually associated with insulin resistance and obesity. Now, as we get older and we lead a more sedentary lifestyle and don't exercise as much, we get more obese, and with obesity comes insulin resistance. And insulin resistance is where the pancreas, which is that part of the body that makes insulin, as you get older and more obese, your pancreas is not able to make and release enough insulin. And because of that, diabetes tends to occur. There's never a good time to become a diabetic, but if you had to choose a time, I would say now would be the best time. The reason for that is we have so many new medications out, so many new types of insulin, so many new types of therapies, new pills, so we can treat diabetes much more effectively now than we could say 5, 10, 15 years ago when I first got into this business. Here in our practice, we use the most up-to-date medications and therapies that treat our type 2 diabetics. And if a patient is motivated and takes their medications and checks their blood sugars, as well as follows a good diet, exercise, we can get really good control of their diabetes. If you don't do that, you have a high likelihood of having complications from diabetes. Those complications include an increased risk of heart disease, increased risk of strokes, increased risk of pancreatitis, which is really bad abdominal pain. Diabetics are also prone to having diabetic eye disease. In fact, diabetes is the most common cause of blindness in this country. Diabetes is the most common cause of kidney failure in this country. If your kidneys fail, then you end up unfortunately being on the outskirts or looking for a kidney transplant. Diabetes is also the most common cause of non-traumatic peripheral vascular disease. And what that means is if you don't get good blood supply to the lower extremities, you're at increased risk of having some type of a cut or infection to the lower extremities, and that's why diabetics are so prone to having their toes amputated, or the below the knee amputation or above the knee amputation. Diabetes is a terrible disease and can do pretty much anything that it wants to do. However, you as a patient, if you work to control your diabetes and get in good control with a provider that is knowledgeable about diabetes, and using the team approach, there's no reason why you should have any of these complications and diabetes should not beat you. You should beat it.